Okay, this video is called Truth versus Conventional Medical BS. Okay, and basically I just had this idea that I thought they would go well together and just a way to express it. So basically conventional medicine when it comes to the chronic Western diseases is a joke. They never cure anything. They're a hopeless, pathetic joke. And I had an internist I was talking to about a year or two ago, and he gave me this attitude. He's like, "You think we don't know anything?" And I'm like, "Why don't you ever invite me to talk?" I said, "I am so far ahead of you that you can't even understand how far ahead of you that I am. I've rewritten all your textbooks. This is a Hollingsworth problem, that I'm like 2 ballparks beyond you, or 3, such that you don't even understand what I'm talking about. All of your books are wrong. They're all a joke." So anyways, this is going to be school time. If you want to tell your doctor to watch something and learn, this will be very educational for them. For anybody who wants to learn about chronic disease, I will say these things. And I don't think I'm bragging when I say I'm the best doctor in the world, because to me this is like 2 + 2, but I don't see anybody else on the internet saying this basic stuff. They're going to know some of it here, but nobody else has put it all together. So obviously, clearly, true, and simple. Okay, number 1, obesity. Conventional medicine says nobody knows what makes people fat. Maybe it's the sugar or the junk food or the processed food, but we don't know. Oh, BS. We know the higher the percentage of calories from high-fat diets, the fatter the population. As Dr. McDougall said, the fat you eat is the fat you wear. We know high caloric density does it. The more calories from fat, the fatter they get. Hyperpalatable food, like the processed food with all the high fructose corn syrup and all the monosodium glutamate, the manufacturer-free glutamate, that makes people fat. The mitochondria inhibitors lowering their energy level predisposes them to become obese. The estrogenic chemicals that are commonly in the food is a fat storage hormone, predisposes them to become obese. We know that. Okay, how do you lose weight? Conventional medicine says no one knows for sure. Maybe try the Mediterranean diet, which is stupid because it's a high-fat diet. Take Gila Monster, Venom, GLPs, Ozempic, and all that kind of stuff. Or go for gastric bypass surgery. Completely stupid. All you got to do is eat a low-fat vegan diet, primarily starch, whole food, organic only. Everybody who does that gets skinny. All right? And everybody's afraid of that. I talk to a lot of fat people, and they're all like, "Oh, I have to give up chicken? No meat? Oh my God, what if I get protein deficient? Calcium deficient? Oh my God." No, you stupid idiot. That's why you're fat and sick. Okay, hypertension. Conventional book says nobody knows. Hypertension is so easy, it's not even funny. Why do you have blood pressure? To pump blood to the top of your brain, your cerebral cortex, okay? And it has to be pumped against gravity. Regular blood has a consistency, let's say approximately like water. When you eat a high-fat diet, it sticks the red blood cells together, overcomes the zeta potential of the RBCs, and thus you're pumping thick blood like a milkshake. You have to pump at higher pressure to get it out there. Sodium's a vasoconstrictor. When you vasoconstrict, because it inhibits endothelial nitric oxide synthase, the vasodilator, then you have to pump thick blood through a constricted system. So you need pressure to go up. A classic meal would be, eating a pizza with a lot of salt on it. And you can throw in some caffeine, which is like psychological stress, elevated catecholamine and cortisol. Blood pressure goes up. So how do you prevent hypertension? Eat low-fat diets and low-sodium diets. Okay, it's pretty freaking obvious. Also, other things that contribute to it, if you're brushing your teeth with fluoride toothpaste or mouthwash with fluoride in it, you kill the bacteria in the back of the tongue needed to convert plant nitrates to NO2s, nitrites. They go down to the stomach. Gastric acid converts it to nitric oxide, systemic vasodilation as it goes into the blood. So you want to get your sunshine. You want to protect your mouth bacteria by not using those artificial mouthwash and toothpaste. Sunshine releases subcutaneous precursors of nitric oxide, vasodilates you, lowers your pressure. You want to eat your plant whole food so you get adequate amounts of potassium, vasodilator, adequate amounts of magnesium, vasodilator, and your plant nitrates. And that prevents hypertension. The incidence of hypertension in populations that eat and live that way is 0. What's the big rule of thumb to explain all this stuff? Live like Adam and Eve, but keep your indoor heating and plumbing. If Adam and Eve couldn't have eaten it, then you shouldn't eat it either. In general, that is true. We also, Adam and Eve had fire. We know that the earliest humans had fire so they could cook starch, okay? I do like raw fruits and vegetables, but cooked starches should be overall the main thing of calories in your diet. McDougall recommended 90% starch, 5% fruit, 5% veggie, and I think that's great for people who are trying to recover from an illness real fast. But if you're reasonably healthy and you exercise, you can eat a lot more fruit than that. You could eat 50% fruit. I eat about 35-40% of my calories from fruit. Okay, and I'm 63. skinny as a rail, energy off the charts, and pretty strong. Okay, next thing, diabetes type 2. Conventional medicine says nobody knows what causes it. You know, bad luck, maybe it's genetic. Increased risk with obesity and aging. That's what they always say for everything. They don't know their head from their ass. It's well known the main cause is eating a high-fat diet because of the flip-flop maneuver whereby the higher the amount of dietary fat you eat, the more gets into your skeletal muscle cells, thus causing overnutrition as it flip-flops into the mitochondria, inhibiting electron transport on the intermitochondrial membrane. And that causes overnutrition, shutting down the glucose type 4 transporter so glucose can't get into the cell, and you get postprandial hyperglycemia. Prandial means to eat. Postprandial means after eating, the fed phase, okay? So just stop eating the high-fat foods, okay? That's the most important thing you do. Other things contribute to it: excessive stress, excessive sleep deprivation, caffeine, likely mitochondrial inhibitors because they're also preventing the intermitochondrial membrane from functioning effectively. Okay, excessive dietary sodium, those are all some things. And I made an additional lecture of additional other minor causes. High fructose corn syrup will do it too because it leads to elevated uric acid, which is a vasoconstrictor, which inhibits vasodilation in your skeletal muscle cells, so the insulin can't get there, okay? What about coronary artery disease? Conventional medicine knows high cholesterol does it. They treat that with a statin. That's about all they know. We know that it's caused by hypertension, diabetes, and high-fat diets, and that atherosclerosis is just a blood clot. So anything that causes blood clotting will cause atherosclerosis. You prevent it by eating a low-fat, vegan diet, no oil, organic only, like the Esselstyn diet, the McDougall diet, the Jeff Nelson diet, the Peter Rogers Spartan vegan diet. Manage your stress, get your sleep, get your sunshine to release those nitric oxide precursors. Pretty basic. AFib and congestive heart failure, atrial fibrillation and congestive heart failure, CHF. Conventional medicines like no one knows, take our pills. We know it's often due to ischemia, so prevent ischemia. It's often due to thick blood mitochondrial inhibitors. Avoid these. Ischemia is due to high-fat diets, excessive dietary sodium, primarily, okay? What else causes blood clotting? We know that leaky gut leads to bacterial endotoxins getting into the blood. That causes an amyloid transformation of fibrinogen, the clotting protein, causing blood clots, okay? Amyloid clots, fibrinolytic clots, they're also called. Douglas Kell from England and Etheresia Pretorius, PhD researchers, figured all that stuff out, okay? Iron overload also causes it because of ferrous redox cycling. So avoid becoming iron overload, which means decrease your meat consumption, decrease eating processed food that's fortified with iron, okay? Happens in men after 25 years of age and women after they're postmenopausal for about 5-10 years. Okay, what else? Abnormal clotting. Conventional medicine says we don't know what causes it. No one knows. Check for rare diseases. I would say look for leaky gut, look for causes of amyloid clotting, iron overload, like I just alluded to. Any autoimmune disease in general, conventional medicine says no one knows the cause. Take our pill. Hopefully, it'll slow it down. We know that most autoimmune disease is due to leaky gut, so you prevent leaky gut, which means eat more dietary fiber, okay, and avoid the things that cause leaky gut. Filter your water so you don't have the fluoride and the aluminum. They cause leaky gut. The glyphosate from non-organic food predisposes to leaky gut. Sat fat, PUFAs, okay, chlorine, alcohol, NSAIDs, aspirin, all of those things predispose to leaky gut, so you want to avoid them, okay? What causes GERD, gastroesophageal reflux disease? Conventional medicine says no one knows. Take our PPIs, proton pump inhibitors, etc. Try to slow it down. We say we know it's due to abdominal pressure syndrome, so avoid the things that cause abdominal pressure syndrome. Eat more fiber, okay? You know, eat your whole plant foods, okay? What about MS? That's refractory to meds, multiple sclerosis. Conventional medicine says no one knows, take more pills. We know that a lot of times it's due to dental amalgams, so extract those dental amalgams and potentially take out your root canals too. They're always infected. Cancer. Conventional medicine says no one knows what causes it, some unknown mutation. Take chemo even if there's no proven benefit, just go with the standard protocol. I say sometimes the chemo does work, but if it's not known to work for that cancer, it's often due to ischemia or Warburg effect and acidosis and poor immune function. Well, try to improve blood flow. Try to prevent acidosis. Try to improve immune function. And we know you can do that with a low-fat vegan diet, no oil, low sodium, get your sleep, get your exercise, get your sunshine, optimize your social situation, manage your stress, okay? And we know that there's lots of people who survived metastatic cancer for decades. That's what they did. Okay, cognitive decline. Conventional medicine says no one knows, nothing helps, but you can try taking our pills anyways. We know what causes cognitive decline. The Peter Rogers, MD theory of supply and demand. It's pretty obvious. Anything that decreases blood flow to the brain, including overtreated hypertension, is going to predispose to cognitive decline. The Jack Delatory theory of hypoperfusion-related dementia, okay? The Peter Rogers, MD theory of supply and demand, including mitochondria inhibitors. I found over 120 of them, decreasing the ability of your brain cells to produce ATP. When ATP drops too low, the phosphatidylserine externalizes into the outer membrane. That's an eat me neon sign, and the microglia, brain macrophages, will eat that neuron and remove it. It's a form of programmed cell death, apoptosis, to remove the neuron before it goes into lysis, releasing its inner contents into the extracellular space, which will cause a big inflammatory mess. You don't want that, so it's preemptively removed in the phase of low ATP energy level and phosphatidylserine externalization. SERCA inhibitors do essentially the same thing because they decrease the ability to clear calcium from the cytoplasm, keeping the cell, the neuron, in a hyperexcitable phase. EMF will also allow increased calcium through the voltage-gated calcium channels to come into the cell. Other excitotoxins include beta amyloid protein, they include aspartame, they include glyphosate, the herbicide. So you want to avoid all those things. What causes back pain? Back pain is typically tissue ischemia and biochemical inhibitors of collagen synthesis, things like glyphosate, fluoride, alcohol, and a lack of vitamin C. So there it is, the most common diseases that cause people, tremendous suffering, misery, pain, and death. Conventional medicine doesn't know anything about what causes them. We know the causes of all of them and how to prevent and reduce them. We can't guarantee a cure on the cancer, and other ones, if you have end-stage atherosclerosis, destruction of the vessels, they're harder to treat. But we can definitely improve all of these things, okay? So anyways, you can improve the patient's quality of life. You might not make them survive longer with cancer, but you can do a lot that can help them, okay? So anyways, conventional medicine is a complete ignoramus for the chronic diseases. That's why they're called chronic, because conventional medicine can't help them at all. It's like Dante with Virgil in Dante's Inferno, before the gates of hell, where the sign above the gates of hell say, "Abandon hope, all ye who enter." It admits it has a 0% cure rate. Conventional medicine, other than cancer, and it often can help a lot with cancer, it has a very high cure rate for this stuff. So anyways, that is the truth versus conventional medicine. So have your doctor watch this, and your doctor will learn from this. And yes, I am the best doctor in the world. You're welcome. I hope this helps you and your patients.